right, we're going to go over chapter 15, nutrition, and so you can follow along in your textbook. Nutrition, the quality and quantity of diet. These are important factors to manage chronic illnesses and to prevent and delay onset of chronic illnesses. Our diet does affect the longevity, people's longevity, especially when it's combined with lifestyle changes, and reduces the disease risk. About half of all American adults have either one or more preventable diet related chronic diseases. So these could include type 2 diabetes, obesity, cardiovascular disease, or being overweight. Factors that impact nutritional needs, these are likely related to chronic diseases, so lifelong eating habits, socialization. A lot of people, eat to socialize, or that's a part of their socialization. Income, if they can't afford like fresh fruits and vegetables, and they're eating a lot of processed foods. Transportation and housing, and that has to do with access. What is their access to good nutrition? Their food knowledge, any functional impairments, and then also dentition. If there's trouble with their teeth, or maybe they have dentures, and that can really keep them from getting adequate nutrition as well. Some age-related things that affect nutrition. If you look on page 185 in your textbook, so I do just recommend that you have your textbook open when we're going through this, because I'll refer to it a lot. But on this box, you're not going to present it to the class, but I do want you to take a look. There's taste, smell, digestive system, buccal cavity, regulation of appetite, and body composition. And it kind of goes through what are some of the things that change as we age that can affect nutrition. So taste, the mouth produces less saliva as you age, and that can affect your sense of taste. Dentures or smoking can affect taste. Smell, there's a lot of chronic diseases like Alzheimer's and Parkinson's can affect the smell. And so it's interesting, without smell, it's actually food tastes different. So an activity that we used to do in class, but you can try it on your own, is to get like a Rice Krispie treat, or to get some kind of food, plug your nose and eat it, and then unplug your nose and eat it, and just see. It's actually quite amazing the difference between the two and how taste is so affected by smell. Digestive system, if there's decreased gastric motility, decreased digestive system, that can affect this. The buccal cavity, if the teeth become worn, that can affect nutrition. Dry mouth, which happens from a lot of medications, that can affect nutrition. And then body composition, a decrease in muscle mass or increase in weight. So I talked about those age-related requirements. So one of the things we're going to look at is the dietary guidelines for Americans. Older adults typically need less calories, and that's because their activity rate usually declines, and so the metabolic rates slow down, so they need less calories. But they do still require the same or even higher amounts of nutrients. So the nutrients that are included in the foods are just as important, even though they're not needing as many calories. So you can jot this down and take a look at it. It's choosemyplate.gov, or it's actually www.myplate.gov. And there's a little quiz you can take there, and then there's some information about life stages in older adults. But this is a great resource if you're trying to do dietary or nutrition education, to direct them to this site, and it kind of helps them see what different food groups they should put on their plate. Dietary recommendations. Fats should be less than 10% of your total calories. and you want to limit saturated fat and trans fatty acids. Protein is especially important. As a person ages, they need more protein. This helps keep them from becoming frail. It helps with healing, and we've already talked about how it helps with wound healing. Fiber, 25 grams of fiber is recommended daily, and we'll talk in a minute about some foods that have higher fiber. Vitamins and minerals. We talked about this, but how these can stay the same, or even the need can even increase. But this, you need 5 servings of fruits or vegetables a day to have adequate A, C, E, and potassium. And changes from aging can cause a decrease in the absorption of vitamin B12. So some people will take an extra B12 supplement. But your daily intake should be 50% fruits and vegetables, 25% grains, and 25% protein-rich foods. So if you were to split that up into a plate, half of the plate should be fruits and vegetables, and then the other half should be cut into 25% grains and 25% proteins. So fiber case study, I'm going to have you read this and then kind of pause the video and do this little exercise. But you're caring for Mr. Smith, who states he has chronic constipation. He has developed an anal fissure due to hard stools and constipation. The provider has asked you to create a teaching plan regarding fiber for Mr. Smith. And so you're not going to present this, but I do want you to pause the tape and kind of come up. Remember, we said about 25 grams of fiber. So I want you to look in your textbook, and you can even look online at foods that are high in fiber and what kind of foods that they may want to use. So give you just a minute. You can pause the recording and take a look at that. All right, so hopefully you looked at the case study and saw some different sources of fiber. You can do fiber supplements over the counter as well. So like some of the increase, like Fiber One, and some of those can be used over the counter. Obesity, which is overnutrition, it's a global epidemic and major public health concern. It is associated with extra cost, extra increased admission to nursing home, increased chronic disease. More than a third of the people over age 60 are obese. So it's definitely an epidemic. On the other side of that is malnutrition or undernutrition, and we do see this in the elderly too. We see it a lot with people that are in long-term care, but the incidence of acute care, we are seeing it more there. And the institutional older adult in long-term care is at higher risk for malnutrition, and this is because of their chronic disease and any functional impairment that they have. Being undernourished or malnourished we've talked about this, but it does put you at a higher risk for developing pressure ulcers, hip fractures, impaired cognition, and increased overall morbidity and mortality. This can be related to consumption of micro and macronutrients or consequences of inflammation. And then comprehensive screening and assessment is really critical to identify older adults at risk. And we're going to talk about one tool that you can use as a tool, and we'll talk about that in a minute. But what are some different factors that affect getting the nutritional needs? One is just poor lifelong eating habits. Maybe that's how they are used to eating, and it is not adequate anymore. Socialization. People like to socialize, and people tend to eat better when they socialize and when they have someone to eat with. So especially in the institutional setting, having the dining areas, having people eat together is really important. If there's socioeconomic deprivation or low income, that can definitely affect nutritional needs. Transportation, maybe they just can't get to the grocery store, or they don't have a car, they have a hard time accessing food. And then there's a myriad of chronic diseases and conditions that can cause this. Polypharmacy, which we is more than 5 medications at a time, being inactive, having high fat, high volume meals, and comorbid conditions. Other chronic conditions that affect nutrition, GERD, so heartburn, this can affect nutrition, and they may just not want to eat because they don't want the heartburn. Diverticular disease, which if you remember, someone with diverticular disease like diverticulitis, it's actually really painful to eat. And so if they have diverticulitis, it hurts to eat, and so they don't eat. And so diverticulosis is common, and a lot of people have that, and that's the pouching in the intestines. But the diverticulitis is when that pouching actually becomes infected, and then that's when it causes pain to eat. Dysphagia, or difficulty swallowing, definitely is something that affects nutrition, and you'll see this in people that have had a stroke or a CVA, people with Parkinson's disease, neuromuscular disorders, or certainly aspiration pneumonia. So if you look in your textbook, there's some discussion around dysphagia. If you look on page 193 in box 1510, the risk factors for dysphagia. Again, we said a stroke, Parkinson's, neuromuscular disorders, head and neck cancer is a big risk factor, traumatic brain injury, pneumonia, and poor dentition. All of those put someone at increased risk for having difficulty eating. And then there's some symptoms of dysphagia. So how do you know if someone has dysphagia? And if you can look on page 193, box 1511, but difficulty swallowing, drooling, choking is a big one. Someone's choking, a hoarse voice or a nasal voice. If it takes them a really long time to eat, you might want to kind of assess their swallowing status. Heartburn, chest pain, weight loss, hiccups, all of those things are signs and possible symptoms of dysphagia. I do want to show there. So I want to bring your attention to this website. It's from Cleveland Clinic, and it goes through dysphagia. What is dysphagia? Remember, it's difficulty swallowing, feels like food goes down the wrong pipe. There's different types of dysphagia: esophageal dysphagia, oral dysphagia. And so it depends on, is the problem in your mouth? Is the problem in the esophagus? Is the problem in your throat? So you can categorize dysphagia based off of those. What causes it? We've already talked about that, but some of these chronic disorders, and you can see them listed here. Other types, cancer, acid reflux, and how is it diagnosed? So usually with dysphagia, there will be some kind of a swallow test or an upper endoscopy. A swallow study is where they drink something with like barium contrast, and then you can actually at the bedside watch the person swallow, and you can see that on x-ray, and you can see if they're able to swallow or if it comes back up. It's quite interesting. So that is something that can be very useful. And then rehab, you want to get someone who has dysphagia, you want to get a speech therapist involved, because they can help them to change how they eat and drink. They may need, if they did a swallow study and it's found that they need thickened liquids, then they can help them figure out how to thicken their liquids. They can show them like the best way to sit when they're eating, and some different aspects like tucking their chin down to their chest, and then how to clear their throat if food gets stuck. And this is all this is all rehab that is done usually with a speech therapist, and it can be really, really helpful. Aspiration. So to prevent, how do we prevent aspiration from occurring? One, sit up when you eat. Don't have patients laying in bed trying to eat. Have them sitting up at a 90-degree angle. Stay up for at least an hour after eating. Stroke the area under the chin. You can kind of stroke that to initiate swallowing. Again, speech therapy, really, really important, and rehab. And then checking for food under dentures. A nutritional screening and assessment. So one of the things, and we'll talk about it in a minute, but it's the MNA, the Mini Nutritional Assessment. And this is in your textbook. I actually do this if there's someone that has like a decreased BMI. I'll do a mini nutritional assessment when I see patients. You want to do just a good physical exam, measure height, weight, skin fold thickness, their BMI. And then also we talked about you might be able to measure some of the proteins like albumin and pre-albumin that can tell you about their nutritional status. These are chronic, on this slide, these are chronic conditions that affect nutrition. So you've got acid reflux, diverticular disease, and dysphagia. And we've talked about all three of these individually, so I'm not going to go over those again. How do we promote healthy aging? One, nutritional screening, which we talked about, height and weight, measuring their diet and how much protein they're getting. And if you look on page 196, you can see there's an example of the mini nutritional or the MNA assessment. And it shows you there's questions that you ask on the top. And then if they score low enough, then you actually you get a tape measure and you check a calf circumference, and they'll get points based off of what their calf circumference is. But you can see 12 to 14 is they're at a normal nutritional status, 8 to 11 is they're at risk for malnutrition, and 0 to 7 means they're malnourished. So what are some interventions we can do to help with healthy aging? One, nurses are really helpful with this. You want to collaborate with the interprofessional team. So speech therapy is definitely a big one with this. Consider modifying their environment. And, maybe they need to be eating meals with someone else. And that can be helpful too. Feeding assistance, maybe they need someone to feed them. And this becomes very problematic in the institutional or long-term care setting, because about 50% or half of these people need help eating. And if you've ever worked in long-term care, you know that there's one of you to about 30 residents, and there's no way that you can help 30 people eat all at the same time. So that kind of inadequate staffing leads to poor nutrition and poor hydration. So your textbook says that Medicare and Medicaid will have feeding aids. I will tell you, I've never seen a feeding aid, but to have, a lot of times what we'll suggest is if they can have a family member who can come in and feed them and dedicate more one-on-one time with them so that they aren't rushed and they can get their entire meal in. I just wanted to point out, feeding a resident is not indicated unless it is known that the resident cannot feed himself. So if they can feed themselves, you want them to do as much as they possibly can for themselves and promote independence as much as possible. Some other ways you can enhance nutrition in long-term care. We've talked a lot about the dining rooms, but having the dining rooms, trying to have their food choices. So maybe if they like a different type of food, you can ask their family to bring that specific type of food in. Trying to do finger foods where they can just pick it up and eat it, and staying away from restrictive diets. They may need to do like a calorie or a meal replacement, like an NUR or a protein powder as a snack to kind of help them boost their nutrition throughout the day. That concludes the end of this section of this chapter 15.